Hi everyone, my name is Loic Etienne. I am an emergency doctor. I am working with Francis Faux in CNRS in France. And I present a modeling and representation by graphs of the reasoning of an emergency doctor with a symptom checker, which is a MedVir. In the beginning, what is a symptom checker? The symptom checker are online applications that helps doctor to obtain diagnosis, hypothesis, and give to patient a tool to check their own symptom and to evaluate their health situation. So the goal of symptom checker is to provide a high diagnostic accuracy with a limited number of symptoms inquiries. Globally, there is two approaches. First, machine learning, Bayesian inference, decision trees, hierarchical reinforcement learning, and so on. And it needs a long learning, its accuracy is weak, and there is a black box effect, but it's fashionable. At the opposite, you have expert systems. It needs quick learning. Its accuracy is high and it is explainable, but it's a whole technology and it's not in the mood. But MedVir is a new solution by mixing the two approaches, and it's based on fuzzy logic to cope with uncertainty. In medical literature, there is not a lot of information because there is two studies in 2019 who showed that there is a paucity of research on clinical reasoning, specifically on emergency medicine. And the clinical reasoning is influenced by several factors. In fact, the problem of reasoning in emergency medicine is to maintain a holistic view of the patient, to keep an open mind, and to improve through criticism. So we propose a modeling of the thoughts of an emergency doctor in 10 steps. This comes from our experience of emergency physicians for 32 years. The goal of this presentation is to describe the reasoning of emergency doctor by technique of graphs and to present a new concept that is neural entity. How does the doctor-patient relationship works? The patient comes with a complaint and the doctor transforms it in symptoms useful for his reasoning to make a diagnosis and to give a treatment. And after evaluation, he hopes to get healing, but it's interesting to know how does it work. Because for the doctor, he asks questions and the patient answers as he can or as he wants. The doctor analyzes the complaint, he negotiates it, and after an inquiry, he makes a clinical examination, he prescribes additional tests, he makes his diagnosis, that he has to explain it to this patient. He prescribes the treatment that needs other consultations and examination for the follow-up. But sometimes he doesn't obtain the healing and the patient comes back to him with his complaint. But for the doctor, it's not so easy because there is what the patient says and especially what he doesn't say to the doctor. In the same for the answering to the question about his symptom, because he said and he's done said, he negotiates the clinical examination, he analyzes that the doctor prescribed, and he negotiates the diagnostic too. He follows the treatment more or less as he wants, and the next examination is the same. Usually he heals, but sometimes it's the status quo. When you see an emergency doctor, it's even more complicated. I did this job during 40 years, and an emergency doctor has two problems. The first problem, he doesn't follow his patient. So after the treatment, he has no news from the patient. And the second problem is that his mission is not to make a diagnosis, but only to consider diagnostic hypothesis because it is the result of the examination that confirm the diagnosis. So his job is above all to take a decision and not to make a diagnosis. When you are for a doctor which is in a regulation call center, it's still more difficult because he only hears a voice on the telephone. His only job for making is to make a diagnostic hypothesis because he has to. His problem is to just to take a decision and not to make a diagnosis. And he has to make anamnesis, which is the most important, is his job. For a symptom checker like MedVir is still difficult because he's not a human being, but he needs to understand the problem. So determining a good eye story is essential. All data are entered into the machine by the patient or by a nurse who proposed it to him. All data are entered into the machine by the patient or by the nurse, and MedVir gives a hypothesis and a decision that is consult a doctor, go not to go to the hospital, take some medicine and stay at home. So all our work with MedVir consisted to analyze the reasoning of an emergency doctor and understanding the patient complaints. We think that there are 10 stages of reasoning, and I resume here the relationship between the patient and the expert system. First, the system has to collect the complaint. He has to determine the symptom that arise from the complaints. He has to select the main symptom, and this moment is the most important because when you see a doctor with a lot of symptoms, he always asks to you, in the end, what problem are you coming to see me for? And at this stage, the system knows the symptom said by the patient, but it needs to search for additional signs. In the first step, he will consider the possible diagnosis related to these symptoms. And in the fifth step, for each symptom, he has a group of questions like localization, intensity, feeling, and so on. He has to make a rapid examination, exploration of gravity and diagnostic hypothesis by vital question. And when he has a better idea of the gravity of the situation, he refines gravity exploration and assumptions diagnostic by major and minor questions. And at this point, he is able to make a differential diagnosis, that is to say, to classify the diagnosis in decreasing order of probability. At the end, it chooses the one or the two diagnoses which are the most probably, and the final severity. And after, he takes his decision. But how to make a decision if he has no diagnostic hypothesis? And it's the patient condition and the physician's experience that allow this to be done. This is the reason why with connection system, they're not so efficient because they seek to diagnose rather than assess severity. The principle of MedVir algorithm, it was to make a reverse construction of the relationship. Here you have a resume of the important element between the input, that is the complaint, and the output, that is the decision. Each diagnostic has under its dependence a non-limited of symptoms. In MedVir, we treat 835 diagnoses with 170 symptoms only, and there are only 66 groups of questions for actually 4,583 questions. That is to say, a lot of links that are named synapses. So the role of MedVir algorithm is to understand the complaint, to identify the symptoms, to ask questions by prioritizing them. And the goal is to arrive at diagnostic hypothesis or not, and especially to assess severity in 100% of the case. And this is possible thanks to question prioritization algorithm I show you after. I show you how does it works in the system. MedVir needs the age of the patient, his sex, how long he has his symptom, and his zip code. He writes his symptom with his own words. For instance, it burns me when I pee, I have fever and chills, and my kidney. And there he haven't finished his sentence. Nevertheless, the NLP system have understood this problem, and at this step, you need to set his main symptom, that is to say, that one who worries him the most. Here he shows urinary problem. So MedVir proposed to him a short list of symptoms, which are the most adapted to the possible diagnosis. And after, you have a slightly longer list of symptoms, and you have nothing here. After, the system asks the type of urinary problem, the sweet, how much temperature, where is the pain in the right kidney, has his sex without a condom, and so on. And after the system asks for the medical environment, and the conclusion is pyelonephritis, that is an infection of the kidney, and other diagnoses less probable. The system says that it would be better to go to the hospital within 1 hour. After, the patient can receive advice on what to do and not to do. And he can receive another explanation on pyelonephritis, so you see here. And he can, after, when he has read that, he can receive a report that he can send to the doctor by email. And it's finished in less than 3 minutes. So it's very short. What happened during this investigation? The patient chose his main symptom, it was urinary disorder, okay? MedVir searches the possible diagnoses which are connected with urinary disorder. And thanks to the question prioritization algorithm, he asked the most important question. It gives, with the answer of the patient, the most probable hypothesis and the decision which is the most adapted. He gives his report, which can be sent to a real doctor for example, for teleconsultation or medical regulation or aid to diagnosis. So I come from pyelonephritis. Here you have the graph. Each element is a neural entity. You have here a diagnosis, the pyelonephritis, main symptom, urinary disorder, all the other signs, group of questions, here is localization, and the question. For example, if I click on the main symptom, the neural entity contains information, and I will come back to after. So here is the neural entity network. It's only for urology in emergency. The first layer, it's diagnosis of pyelonephritis. The second layer is symptom, for example, back pain. Third layer is localization, and fourth layer is the question. It's in the left or the right kidney. Now, if I go in the further, you remember you have 10 stage. I begin by the first. It's the plaint. The plaint. This is a trigger. That is a triggered patient input. It is understood by NLP and LP, natural language processing, which is using a glossary of MedVir that collects symptoms in the first layer. Here is the choice of the main symptom, and from this point, the start, of the prioritizing question prioritization algorithm. In the first synapse, it calculates the possible diagnoses that are connected in the second layer. The group of questions solicited are in the third layer. And from 6 to 8, in the first layer, are the questions that the most important to reach the most probable diagnosis. The diagnosis, hypothesis, and severity is calculated in the second synapse. And in the 10 step, it's the output decision. So to understand, each layer contains neural entity S, D, G, Q, whose display in the server is driven by the QPA. And the calculation of this QPA is done with weights in the synapse 1 and 2. And we will see further how does it work.
Loic, you should try to conclude because we have very little time.
So here is the algorithm. I go very fast. What is important to understand that is the display of the question. This depends of the threshold of prevalence (PV) and probability of diagnosis hypothesis (PhD). And patient response triggers the calculation of severity and probability of diagnosis. Neural entity, I go very fast. You know, you have non-numerical information, semantics, membership characteristic, reference to ontology, and numerical information which is positive weight and negative weight. Here you have the calculation, and the after you have the supervision learning. Here you have I have to go very quick. The scenario, it gives pyelonephritis with a percent of 22%, and after confirmation of diagnosis by the hospital, it going in the container, and the container is able to give new weights, positive and weights, and it's change the weights in the system. So you have all this system, all these elements we put. 87% of correct diagnosis was suspected by the questioning. And now the next step, modeling of, we make a modeling of uncertainty and explicability of each diagnosis in medicine by a neural network in 6 layers. Okay, sorry, I was a little long.